Okay, it will be available, recorded. We will post that. However, you will not receive any learning units unless you were to try and self-report. We don't have any, we can't do that there. So let's do a little bit of housekeeping before I turn this over to Sam. First, look at all of you muted people. You know, that's good. Please, it looks like everybody is. Please remain muted. It just makes it easier for Sam, for the presenter, easier for everybody. I don't see any phone numbers. If you ever use your phone number, please make sure that you either change the number to a name, or when you email your confirmation that you attended, that you also include a phone number, because we have no way of recording units for a phone. And we don't necessarily know who your phone, what your phone numbers are. That'll be a big help. At the end of this meeting, please do email Marilee. You should have her email address at this point, saying you attended, provide your member number, so that way she can record your units. And the one other thing is, do use the chat line. In fact, as Sam is going through his hour and a half, go ahead and add questions in there. He will hold the Q&A until the end of this course. So, but he'll be going through the chat to go through it all. So don't feel you'd be left out. And I'm sure after he's gone through the chat line, you can definitely go ahead and ask something in person if you would like to. It does end at 6 p.m. I'm not going to cut it off then. If there's a Q&A still going, if people want more information, it'll stay on as long as you need it. So at this point, I'm going to turn it over to Sam to start the program.
Are you sharing the screen with me?
Yes, I am.
Okay, you guys can see you can see this?
Yes.
Very good, very good. First of all, I hope everybody's good. And I am a newsaholic, and every story is bad. And it's just to let you know that the cities had only one speed called slow. With pandemic, their speed has been changed to much slower. So just to let you know, this is in two parts. I'm trying to get the more practical parts on the 1210 part 2. And the more I wrote, the more I was scaring myself. Let me put it that way. And I promised the last time my WordPress blog was having trouble. I'll definitely post this thing. It's already there. A very generic portion of it is in my blog, but I'm going to post. It's 107 sheet, 119 pages. And then I will be adding more for the second part. And you'll see some practical examples that I will show, both on the new construction as well as the existing ones. I want to acknowledge I have one person out of Houston in our group called Bill Calvert, and he's actually a client, and also he's a risk and analyst for oil companies, and can get into this pandemic issue onto the nth degree. So I just want to acknowledge, thank Bill for being here. I didn't know how to name this because there was a design issue, and I'm doing LEED and a building that literally we just submitted. And there was a management issue as well as a design issue. And the more and more I found out that there's nobody out there. Everybody has blogs, everybody has, even the attorneys have little write-ups just to make sure that they can go and sue somebody. Architectural firms have little here and there. Even CDC says these are guidelines. There's no mandates. There's nothing there except whatever that maybe Cal OSHA has, and they all are mishmash of CDC guidelines. BOMA has a system that has given to the property managers, and they're using that for a more of a cover themselves type thing for legal issues. But there is not a very, very direct, concise package. So I've been scraping everything, how to package this lecture, especially with regard to the building codes and building management, et cetera. If we are going to apply this, whatever that I'm going to say, technically the building code and energy codes are out the door, completely out the door, because once you're going to be diluting the air from outside so much that you can kiss the 15 CFM per person goodbye, and you will be almost running. But by the way, an air conditioning unit can work only 50% outside air. An air conditioning unit is not like a swamp cooler that you bring in 100%. So you can only bring 50%. So the other 50% has to be recycled. But anyway, everybody knows me. I see a lot of names on the list. And by the way, I'm still licensed here, and it has nothing to do with the Electoral College. I had it red and they thought I'm Republican. I had it blue, they thought I'm Democrat, but I'm still holding all these licenses. And they're actually pushing me a lot to do ethics tests. So I'm very, very ethical person. I thought I should throw this on there for you guys. There's a lady from Orange County that got selected by Forbes magazine, the 30 under 30. She happens to be my daughter. Anyway, she got selected, but I thought I should throw that in there. Let's go back to the basics. Coronavirus is a virus that is out of a family, and it has little crowns. That's why it has corona. It has the word novel because it was first time. They added 2019 to it because that's how it was found. And there are two groups of people, WHO and ICTV and ICD, decide on the name of a virus. Just to let you know that this virus essentially it gives you about 83 to 99% fever, the loss of appetite up to 84%, fatigue, loss of smell, the bluish face to the lips, and decrease of white blood cells and kidney failures and very high fevers and so on and so forth. These are some of the symptoms of this particular virus. I actually gave this talk in a minor short version of it in June 15 to the ASHRAE. At that time, we had only 2 million cases and 115,000 people died at that point. Right now, we are close to 15 million. Actually, as of today, we passed 15 million, and we got 283,000. In this particular case, we had about 1,000 person dying every day. That was what I call 5 plane crashes. This one is considered about 1911 per day. That is how bad this thing is. There was one source that I would go to, but I changed my mind, and I'm now going to Johns Hopkins, this particular site. It does give me, as of 8/26/12/7, United States is 14.9, 1.5 million people died in the world. Some of the numbers, especially in the some of the African countries or South American countries, their numbers are not very, very active, or especially like Ecuador, etc. So this number could be much, much higher than the 1.5. I will not guess at that. The other issue is that I was raised in Oklahoma. The state of Oklahoma has about 49 counties. And so when I went to high school, I thought I should throw something in there. This red zone simply gives you the most COVID risk level. The entire state has about 2.2 million population, the same as Orange County. I picked up a county simply when they have no more ICU beds. They have none. Tulsa, which is up here, Tulsa had about 68%, but all of these counties are bringing all their patients to Tulsa. And I just saw the news in Nevada, they are using the garage of the parking lots in Nevada as the emergency hospitals, ICU hospitals. This is the nature of this country right now. It is sad, and I do not want to go further into that. If you want to go and find more maps, you could identify whether you go to usafacts.org or you go to Johns Hopkins, and you can identify just about every day, everywhere close to that. The sad part that I do not understand, I just do not understand. The world is about 7.78 billion people. We are about 4.5% of the world. Yet at the time in June, we were 25% of the infection and about about same, about 20%. Right now, we are about 22% of infection of the world and about 18% of the death of the world. I am using CDC as primary reference because just about everybody does that. And I went to CDC. They have little bit of sections called CDC under implement engineering controls. And you can see these are the physical barriers and these are the air curtain sharing, and they talk about air handling. I can guarantee you not a single, and I will show you the papers that has been published, not a single person has been addressing the air handling issue. Bill and I, we were working together with a building down in LA. I guess they got so scared. There was a building, brand new building that was getting occupied. I guess the amount of information that I passed on or Bill passed on, they got so scared, we never got the call. Just an FYI. Another issue is that there is a town in Southern Orange County that right now we were going to change all of their air conditioning systems, but because of the COVID and they were simply putting the budget for 2-3 years from now, because of COVID, the entire city hall is getting changed, and I am redesigning it based on the items that you will be listening today. So this thing is out there, and these are some of the numbers that I mentioned about COVID, and that the fact that 67 million COVID cases out there, and yet these were the numbers in June, and these are the current numbers. And I mentioned about 22 and 18.37% death, which is bad, And let me give you one more item. This is a YouTube that my brother's son is a scientist at the VA in Oklahoma. He sent this. It is in my blog currently. You can actually put it in. I will put the whole thing there again. Please go to that. It shows a graphical form how COVID-19 actually attacks into the system. And let me give you two small items right now. The the vaccine czar of the country is a Moroccan or Algerian guy, bald-headed, very tall guy, that simply said the reason this vaccine were only 8 months to the making was that for the past 20, 30 years, they've been doing a lot of little subroutine programs for creating vaccines. So what they did was they literally took a lot of items from the shelves, and Pfizer or Moderna, et cetera, or the Oxford, they simply took all the items from the shelf and reused it. But what is interesting about mRNA, about 20 years ago, an individual came out and that simply found a gene within the body that simply can be taught to tackle any foreign elements in the body, and that's the mRNA, and that's a 20-year-old item. I will find out who that scientist was. I will actually like to bring it up for this. Just because you guys were architects, just to let you know, in Paris, somewhere around 1853 to 1870, because of the major pandemic in the through the sewer system, et cetera, Napoleon III actually began modifying Paris, and it all the way went to 1927. They modified the entire country, and this renovation was called Haussmann renovation. It was actually, they remodeled the town in order to comply and get rid of all the diseases that they had. It was based on overcrowding in the suburbs, et cetera, et cetera. In London, about 1854, there was a Broad Street cholera outbreak or Golden Square outbreak. The same thing happened, and at that time, 616 people died. At that city, that district was also modified in order to get rid of the infection. And that was literally modifying the city, although cholera was not a sewer issue, but they modified everything. And also in New York City, about 1800, it was called tenement housing. There were people literally dying because of the overcrowding and the squalors. And guess what? By 1900, about 18,000 buildings were built, 2.3 million people. About 2/3 of the whole city population was occupying that. So I am thinking those are at a city level. I am thinking based on our discussion, We will be looking at, again, there is no discussion on the AIA, very little on the ASHRAE of what to do with the buildings. And we'll have a little bit of examples. And by the way, I am an engineer for 3 high-rises in LA. And unfortunately, because of the cost, et cetera, nobody's moving on that. But again, there are two areas that create a change. One is when the legal battles begin. And right now, the Republicans are asking, in the new money that is getting released, they're actually simply saying they got to give relief for all the employees of the factories or the companies so that they will not be sued. So there is that discussion right now, and that's 1 day old, by the way, this story. But the issue is that you still have the civil court, and you have that. At the same time, the codes may start putting something, and I know on Ebola, if you recall, when the Ebola was happening, a lot of touchless, handless toilets, toiletry, all that was there, and came about in the bathrooms. At the same time, these have not gone away. The influenza is still there, cholera is still there, malaria is still there. Those are emerging, and these were the previous ones that are still out there, that with recent outbreaks. The other item is again, I'm going back to CDC. Again, if you want to sue somebody, you have to have a reference in CDC. And I picked this thing up. This actually is in 2 parts. And by the way, these are hyperlinked. Once you pick it up, you can touch it and go to the hyperlink for the entire article. I actually broke it down to today, as well as part of it for next time. And at the same time, this was written for community work and school. And it goes through and simply brings up to the following. First of all, this ASHRAE guideline is very old. It has nothing to do with ASHRAE 160. It has nothing to do with our discussion. But all of these other items, the stagnant water, rodent pest, and mold controls are in the green code. Nothing has been addressed. But I'm going to bring up this issue. Employers are responsible for providing safe and healthy workplace. So if you invite people to come back to your workplace, God help you. And I believe I have a slide that simply says, once you pick up COVID, and if you're asymptomatic, well, nothing will happen. You're just going to be a carrier. And just to let you know, 34% of all the patients who went to North Dakota just to do blood tests on something else, ironically, 34% of those blood tests came out positive COVID. And they're assuming that 50% of North Dakota and the Dakotas are right now COVID positive. And that's another story, but just to let you know that if the individual picks it up, it's within 3 days before the symptoms actually begin. So if the guy does come in and becomes infected, and he got infected somewhere else, and I have a very, very elaborate Chinese work that was I will show you that he could pick it up somewhere else, but he could simply say, look, I picked it up in my workplace, and that will trigger. And if you simply, this is ironic, I simply typed in COVID cases. Ironically, the word case becomes a legal case. A lot of attorneys have done write-ups, and you can see individuals have done a lot of write-ups on that, and you will see. And again, that was one item. The other item is that again, on this right here, hierarchy of controls, CDC simply says you have to have some sort of a mechanism to begin tackling this. And I simply brought it out of, and I placed it here. So the CDC part, the part that I have left is here, ends here, and I will pick it up next time. This is the hierarchy of the controls. And if you look at the hierarchy of the controls, this is the system of the wearing of the clothing, whether it's masks, et cetera, et cetera. And Bill, I went to DC and came back, and Bill just gave me an entire spiel on how to get onto a plane and change the way people work. And that becomes when I do a lot of these programs for ARE. Now I'm doing it for USC. You have the programming and planning where you as an architect, you do all these little sketches that ironically, that is going to be, it is your work. And engineering control, that would be how to isolate the people from the hazard. Now I'm going to go back. If you got a security group, if you got a legal chamber, you got an accounting, you got a very high sensitive software development, you have all these secure controlled group. The other item is the general public. General public cannot come in to the interior of the building, as it is like city of Los Angeles right now, that will not allow you to come in, or many cities that are technically locked down and you cannot go in. Substitution replace hazard. I'm so sorry. This virus isn't within this sphere that's called the world is there, like the influenza is not going to go away. It will stay with us. And once the vaccine starts, you're going to take the vaccines every 4 months, all 7.8 billion of us every 4 months. And hopefully, and by the way, just to let you know, the vaccine is only 10% or 4% not active. So 94 or 90%. So 33 million people will not be immune to this. So this is the hierarchy of the controls, and that's how you are looking at thinking process. There is a PTD, which is the prevention through design. That would be your baby. As an architect, you're looking at that for your system, for your thinking process. Elimination and substitution. How would you reduce the hazard? How would you control it? This will be more proactive. Some of the engineering issues that I will be discussing here, and whether it's clothing and or air conditioning or isolation through NFPA 101 that you all are very good at. You have an administrative control and as well as a PPE. I would simply say you will have someone like Bill Calvert or some sort of a police control or somebody within the company that will be responsible to ensure everybody that is within your hemisphere of your workforce is going to be doing all of these administrative controls just to ensure that the company is safe. Of course, you can modify and adjust the seat furniture, et cetera, to meet the 6 feet guidelines, but I will show you that this 6 feet is arbitrary depending on if you are next to me. I am very active. I'm always jumping up and down. I could be 8 feet or 12 feet. And if I sneeze, it could be 26 feet or 40 feet. So all that it's an option to just let you know. One of the most critical part is the bathrooms. And I have a section coming up in the next session. And then I'm actually talking to Zern on that issue. How do you make the bathrooms? Because that's the most congested section. And if you go to Home Depot, et cetera, they've blocked off some of the sections and so on and so forth. I'm going to bring this thing up right now. There was CNN had a conversation that simply says, if you're going to the airplane, what would you do? That simply says you wanted to have at best minimum number of touch to the surfaces, i.e. your coffee maker, your doors, your chairs, et cetera, et cetera. That's one part. And so it would be a no-touch activation method. And in this particular case, the HVAC, these are, I got to tell you, these are mumbo jumbo. It is there, but there is not a zero information by anyone what to do. But these will be used when the Jacobian Myers calls you and will simply say, did you do this? Did you do that? Et cetera, et cetera. And that would be, for those of you who don't know, Jacobian Myers is the attorneys who are ambulance chasers. But anyway, this right here, total airflow supply to the occupied space. Again, if you recall, with regard to if you do LEED, if you are just a basic building, the California Building Code as well as the energy codes require you to have 15 CFM per person. But I can tell you, guess what? You have to maximize it if you want to reduce the liability. Demand control ventilation, if you were in my class last year for Title 24, DCV is now part of the code. But guess what? He says, excuse me, sir, disable it, out the door, goodbye, done. So you have to go in and you double cross that. Is no longer part of Title 24. So you're looking at Title 24 issues. They are asking for you to change the air filtration, and I will get into a very, very detailed information for that. By the way, just to let you know, once these filters are done and they are all contaminated with the with COVID, your air conditioning guy has to go with a full PPE to remove them, because now these are fully contaminated. They're now part of the process. So they want to make sure that there is no leakage, so that you don't have, and that's by the way, part of Title 24. And there are, you want to bring some outside CFM. Generally, they call this morning chill out. At the same time, you want to change the room with fresh air in a economizer mode, so that when it starts, again, clean to less clean air movement. So this is, if any one of you have done hospitals, this would be the concept, that you're going from clean to soil, et cetera, et cetera. I don't do a lot of hospital, but I do small surgical centers. With regard to HEPA, HEPA is you can consider it, but you can't use it. Why? HEPA actually has 1 inch static pressure. Unless you are talking about a laboratory, a surgery centers, et cetera, you cannot use HEPAs. Your normal air conditionings do not have that static pressure. So just if somebody says, I'm using HEPA, and I've seen a lot of these churches simply say, you're doing this, but and ironically, it's the pastor who is saying it. And they just, I believe they need to go become a mechanical engineer first before they do the preaching. And we are also talking about restrooms. The restrooms I am considering, remember that the code is actually asking for about 10 air changes. I always design by 20. In this case, I will create a hurricane. The most critical part is to create the amount of CFM within the exhaust fans, and also it has to be uniform, so it cannot be collecting from one person to another, and then exhaust out. We have to ensure that generally exhaust fans have only one point of entry. That has to be done. Now, ultraviolet, and this is called the germicidal irradiation. And the only thing I know about UV is extremely high. I have a very, very large koi pond, a very large one. So I put 120 watts, and I know all about it. And there are 3 types of UVs, UVA, B, and C, and we'll discuss that a little bit later. So these are all coming from CDC. If you are looking at a reference, that's CDC. 3 publications that I bumped into, which I'm sort of bringing in. It was a British journal that was actually done for WHO and the European Union. It was a very, very detailed, actually the appendices were very, very detailed. It was extremely written, boring format, very, very boring. And I can tell you that, but the beauty of that, they discussed CFM, outside airs, et cetera, of course, liters per second, not CFM. The Chinese, there are actually these 3 guys, Jia, Zhang, and Li. They've done a ton of papers, and on COVID tracing, and they've done a very, very good job, and I'm going to show you. ASHRAE did not get into this discussion, but they wrote a very nice generic article, and they do say that they don't have a publication, and they don't have a paper so that they could issue it for the engineering community. There are a bunch of other sources, CDC that I mentioned, BUMA that I have actually put in for the next section. Legal firms, I picked up some of their spiel. That simply, they're just getting ready to start suing people, the legal firms. AIA has it, but very, very, very generic. There is nothing there. And I don't know, Gil said that Orange County has a site, and Gensler has done a reference section, et cetera, but nobody has come up with anything. The only thing that AIA has done is primarily simply telling to the architectural firms how to control their firms, and et cetera, et cetera. But one of the items that I'm going to say, this was a trace analysis that Jia, Zhang, and Li did. And they actually followed 3 towns, Liaoning, Heilongjiang, and Jilin. They went to the 3 towns and they simply compiled all the individuals who were infected. I'm going to zoom in. How did they get infected? Let me show you. I have these. I'll take this. How did they get infected? They did a very, very good study. And I will tell you where our discussion is. This is within restaurants. This is within public buildings. This is a family gathering we will not discuss. This is public vehicles in terms of buses and so on and so forth, we will not discuss. So we are interested on these public buildings and these restaurants. So as you can see, the very, very concentrated dots, as well as the just a very slight differences, like these individuals who got infected, or these individuals who got infected, these were family members, and apparently this guy travels with a bus and infects these 2 individuals, and all of these individuals, and these are the different districts within a town that they went to. So this is a very, very elaborate, very, very nicely done. So really the most critical part for us, what happened and transpired in the restaurant, what transpired in the public buildings. And again, don't forget this thing, once we open up and we have the vaccine in our arms, etc., in my case, just one arm, once we have it, the issue that you have is that do we trust it, in the sense that we have to be immune every 4 or 5 months. We got to continuously test it. And what happens if I'm within the 10%? I'm going to be causing more pain to the others. So that would be some of the issues. So this is one of the items that we are discussing. The mostly second time, maybe we will get it on this particular case. 87%, this was a choir. I believe it happened in Ohio. This individual was in a church, and all of these individuals simply got infected. 2 of these individuals died. These individuals were unaffected. 30 confirmed and 20 probable out of this 52 individuals. So again, by the way, Supreme Court has simply said, based on the First Amendment, the churches can be opened and you can have a demonstration or do whatever as long as it's First Amendment. So I don't know what this means. And I know that the church that 3,000 people that Trump went into in the beginning, it was in Arizona. The 2 pastors were simply saying they have all of these elements in the system, and we'll discuss some of that here. Again, all of these are probabilities. I'm a nuclear engineer. I studied probabilities. So the issue is hopefully nobody dies. Even one person will trigger that legal battles. Transfer of the virus, again, this was from the Zhang's paper. This is the individual who's getting infected. He's going through the hand, going to the surface, a loss of viability, and he could be throwing droplets, and we'll discuss about the droplets and the contacts, and the droplets could go through a membrane, susceptible, and it could be going through the air, through inhalation, and you would be infecting somebody else. So these are the means and methods of the transfer. So we have to know all of these issues and be able to do a better design parameters. And I will discuss in a few minutes on surface contamination. I did not know that I'm actually going to be using my master's and my PhD work on this paper. One of the issues there's 2 theories I'm going to bring up. One is called Psalms theory, that simply says that I wrote this paper in nuclear engineering and design. This was in 1980, and I worked on nuclear bubble nucleations, and simply says if you have a rough surface and you have little bubbles of air, liquid, it's better for you not to have these, and you have a very smooth surface, so that you will not be collecting this coronavirus infection on those surfaces. And at the same time, in my PhD, I was studying the surface roughness in uranium mines. And this was, I have like 3-4 papers out of this that simply says when the surface is very smooth, you're going to collect less radiation on the surface. So the SAMS theory, based on those 2 papers, says that if you have a smooth surface, you can clean the contaminant easier, no deposit with time, and you will not have collection of contaminant sources for dispersing, i.e. COVID or whatever that you have. Ironically, I ran into this paper, which completely is opposite of my discussion, by Bowden and Tabor in 1950, that simply says, hey, have the roughness so your hand will not be touched. Ironically, again, if you go to Costco, and every time you're in the self-help area, every time somebody uses, the lady mops it out and washes and leaves. If the surface roughnesses are more, that lady will be scrubbing these roughnesses to get those elements out. I believe I am right, and I believe Bowden and Tabor are not correct. Anyway, this came out of the same paper, of Zhang's paper. Just to let you know, and this is very, very interesting. In one of my past ages, I was working on the Venetian mud on the walls, and the individual who was collecting it and was making it, he actually sold it to Sherwin-Williams for the rights of it for 10 years, and he was looking at adding aluminum oxide to the elements, because what happens with aluminum oxide, if germs, etc., sit on it, the life expectancy of that germ goes away. And then the other issue is that if you use copper, for example, the survival of the aerosol COVID-19 is only 4 hours, cardboard or paper is 24 hours, plastic and stainless is 72 hours, and COVID actually will survive in the air for 1 hour, okay? So if you are all dropping plans at City of Los Angeles, they drop the papers, as well as Newport Beach, you drop the papers in a bin, and then 24 hours later, they actually touch the paper, and they do the same thing in reverse. Again, this discussion that you have here, because of time, I didn't want to put it in. There's a very, very nice, both Princeton as well as MIT, has a projection of coughing out of individuals. It goes from 26 feet to 40 feet. Again, if you're like me, I'm just hyper going back and forth, a very high decibel, and 8 to 12 feet, and a normal condition would be 6 feet. These are the travel distance of the moist without a covering. Just to let you know that COVID-19 is about 0.12 or 120 nanometers or 0.12 microns. If you have a surgical mask, not 89%, and a regular vacuum cleaner, 86, now dish towel, etc. Right now, they're in the beginning, they were having a hard time having the N95s or these triple fabrics for masks. They were having a hard time. They simply said, just put anything there. Right now, they are begging people. I can tell you the price of those masks. I used to buy them at $1.25, then 75 cents, then 30 cents. You can buy them at a bulk price for less than 10 cents now, just to let you know. And when I was flying, I was putting 2 plus another item. I was like a monster or a surgery center inside the airplane. Just to let you know that the actual COVID actually lives within the exhaling or inhaling the air that we are sending out. The reason, one of the items that these are doing their job, because the COVID is actually 0.12 and surgical masks cannot pick up 11% of that. What happens is that once it is combined with the moisture of our mouth, actually it is captured quite well. But they are pushing and they're begging to go with at least with the pleated hospital mask. So anyway, there are all that discussion. All of these are discussion for getting ready for your knowledge, so that we can build a design parameters. Again, N95, guess what? It gives you a 0.1 to 0.3 microns. It gives you about 95% effectiveness. Then you could have a more solid, better than N95, depending on what systems, microns in terms of bacteria size, but a virus is much, much smaller. The other items that I am bringing up, we all have studied as an architect. We know the building design issues, and we are going to concentrate. When we are in an earthquake, we had all these seismic elements. When we are doing fire, etc., we are dealing with compartmentalization, NFPA 101, Chapter 3 and Chapter 5. What about COVID-19? At the end of the day, really, it becomes a partial fire and partial hospital, partial of everything. We have to put all of our sort of a subroutine of knowledges that we put on that shelf. We got to pick them up and use them for the interest that we are looking at. Again, I just pray that we're going to be, AIA Orange County will form a team or a group that I will not be the only spokesperson, and we can go into different tangents, especially on surfaces, on different formats. My DNA, because my father was in stone and I'm a stone man, I put a ton of it in my house. You want to have the grouts with the minimum format, so you have the least soft, least amount of grooves, et cetera, et cetera. Those are some of the issues. So again, I'm going to go back. In one of the educations that I did, I went 3 years at UCI, studied fire protection engineering. So I really got intimate with NFPA 101. NFPA 101 technically is the gospel of California building code, or the CDC, or the building code, because of the compartmentalization, the fire egress, et cetera. Everything comes from there. So really, we could take a lot of lessons from there to the COVID-19 design for formats. Now, if you go to Walmart, of course, nobody actually does it. They have put pathways, so no two individuals, their faces will be crossing each other. They have put the exiting and the entrance. Again, mind you that you have to have fire exits, etc. But for COVID-19, you have to have one-way pass. So you come in from one door and you have to leave from the other door. So at no two point. And then if one of you guys have done schools, you know that in schools, you want to have a dedicated air conditioning unit for every class, because when one kid becomes sick, you identify the whole entire class. And if that air conditioning is centralized, it'll make everybody in that air conditioning system will make them all sick. So the issue goes back to cross-contamination. And then again, we dealt with schools, and that's why especially those barred units, which are for the portables, were very famous for that, and so on and so forth. In high-rises, you have a lot of challenges. I have a high-rise that is 33 floors on one side, 11-story on one side, and the 11-story in the 33 floors, each one of the floors have their own air handlers, but the 11-story has one central air conditioning units, and that becomes a very challenging system. I am trying to put a system, and we will talk about it next time, how you can put a package together. I'm not selling products, but again, the design that I did for that town in Southern Orange County, I am using a VRF system. I'm putting a 44-ton Samsung unit with literally for every 44-ton, I can have 64 zones, air conditioning zones. Every room is going to get their own air conditioning systems, etc. In the high rises, there is a solution for them, or for existing buildings which have VAV boxes, there are solutions for them that we will discuss next time. I'm trying to stay on the basics right now. This is a system that I just discussed. You have the outdoor unit, and you simply feed all of these babies throughout, and you bring fresh outside air to them, and you have a central exhaust fan with no kind of cross-contamination from one area to the other. And each one of these will have all the amenities that we will discuss very shortly. In 1992, I chaired an international IEEE symposium on international conference in Anaheim on biological effect of EMF. I don't know if you recall, people were saying that EMF was going to cause cancer. And every time I would go to a building, they call me Dr. Bzzz. So every time they would make fun of me. And I learned one thing there. It's called prudent avoidance. And technically speaking, if you are the architect, you have to have the same way that you put the P2, what was that? 2K, the 2000, everybody had those CYA notes when P2K time was there. You may have to add this, that you are still designing the system the old way and you're not considering COVID for the design. But just to let you know that you have to announce it maybe in your contract, etc. But at the end of the day, prudent avoidance simply says is a precautionary principle in risk management. It states that reasonable efforts to minimize potential risk should be taken when actual magnitude of the risk is unknown. So if you don't know it, you're just doing certain due diligence, and that had to do with where do you put the electrical systems, where the electromagnetic field was, and it was that causing me to lose hair. Look at this. Was that EMF that I lost the hair, or was it just age? Regardless, that was a lot of issues. With regard to the filtration, California Building Green Code, we are already in MERV 13, and MERV 13, I will show you what it means. But if you go to Home Depot, you don't see MERV 13. You see MPR or FPR ratings. And if you go to the highest rating of these at Home Depot, you will actually get MERV 13. MERV 13 is only a 2-inch format, and we will see what's happening there. Now, what is happening in MERV 13, MERV has nothing to do with Merv Griffin, the guy who had the TV programs. And MERV essentially was minimum efficiency reporting value. And it went from 1 to 16. And then once you go through 16, you jump into HEPA. I will guarantee you, we have done the studies, and I highly suggest you cannot use these. MERV 16 is very expensive, and MERV and HEPA is very high static. You really can't do much with it. So you really are stuck in here, MERV 13, which is right between the two. And that's where the problem is. We have actually done this study in a couple of places. It did not work. We are really trying to make sure that the air velocity comes down. And as it comes down and it's going through the filter, you have to be about 300 feet per minute. If you are 500, the efficacy of the filter just goes down. Placement of the pressure difference, etc. So as soon as that filter is diluted, or I'm sorry, concentrated, it has beyond that, you want to change it. And don't forget, the guy literally has to be in spacesuit to go in to take them out, because now those are all contaminated. Now you have to have good maintenance and make sure that there is no leak. So you don't have a giant hole where all the air is passing through. You got to make sure that that is being picked up. So those are some of the issues that we're looking at. The heating and maintaining of this, these, by the way, I did not write these. These all came from different papers, CDCs, etc. So the issue of the HVAC, you want to have the indoor temperature and humidity. By the way, humidity does have an issue. Odor, we are not going to discuss. Removal of the contaminant air, which is what we discussed. Susceptible staff and the patrons, you want to make sure that the requirements, you want to protect the individuals which are there. And again, you want to ensure that the risk of transmission to the individuals are less. Now, these are some of the discussions that I'm going to bring up. And by the way, I'm going to open up at some point. I really want to get your opinion. And if you put it in chat, I'm going to copy them and maybe put a response, because this is a very new frontier. And I know most of you, and I know a lot of you have come with a good backgrounds in architecture and different formats, construction, etc. So we all need to put this frontier together. And again, this thing is not going to go away. And by the time we are done with this infection, the vaccine, etc., if we do it correctly, I'm going to put a correct quotation, if we do it correctly, and if everybody gets vaccinated, you're looking at beginning or middle of next year, or maybe towards the fall of next year. So just an FYI. So I have put some of these in my 9,000 body LinkedIn. I put all of these little cases in LinkedIn. And in this particular case, I'm showing these air distribution, how it affects your building. And I'm not, again, I do about 2 court cases a year. You really, really want to put some sort of a CYA note in your contract, et cetera, whether you're dealing with an existing building or a new building, et cetera. You want to, once you see these cases that are out there, and these, you will see it's very scary. So in this particular case, it was a South Korean restaurant with 31 seats. 9% persons got infected. There was 1 person who came in. Everybody, by the way, they were all 6 feet apart. And you can see there were two individuals. And where's that for? Okay, jumped here. These 2 units were actually the air conditioning path was here. This individual was here. The approximate time that they actually sat in this restaurant was about 53 minutes. As you can see, I mean, these tables are very, very large as you go to a Chinese restaurant. These are the rotational type system. And you can see what happens is they are simply saying that the air conditioning path was going this way. And that's where the A1 in January 24, January 29, 27th, A2 picked it up. 29th, A4 and A3 picked it up. And then these in January 31st and 27th, these 2 picked it up. And then in February, these individuals, ironically, these individuals did not get it. And when it goes back to my statement, the design of the air conditioning, et cetera, is going to be interesting. This was in Guangzhou in China. Again, they are simply saying that by adding UV lights, inline filtrations, et cetera, you could reduce this probability, and it will show some of the probabilities there. This was very interesting. This is another one actually in Korea again. And the 2 air conditionings, this was the airflow path of the air conditionings. These individual picked it up. A came in, C picked it up, and B and D picked it up. And the irony about these is that none of the workers, employees, because they had masks on, they did not get it. Just an FYI, this is the format. These were the visitors and these individuals who got confirmed cases. As you can see, again, I don't go to a haircut. I've been cutting my own hair. As you all know, with one hand, my one side looks good and the other side doesn't. So it looks like the Phantom of the Opera. And I will not go for a haircut. In any case, they are simply showing that they were 21 feet away in 5 minutes, and the interaction, the infection occurred. This particular case was a very interesting one. This was in Starbucks, and the flow path was there. And I'm going to have some write-ups on the 56 cases was the 27 plus more of the individuals who went out and created more cases. 27 individuals who were got infected in that Starbucks. None of the employees had it because they all had masks. And at the same time, that 27 became 56 by the time these groups were done. So as you can see, 3 families, 9 other people across 3 families got sick, and so on and so forth. There was one incident that happened in Irvine. There was a wedding. I know it was a kids program, some religious program for a kid, and where 238 people were in that party in Irvine, and the family members got it. They did not know. They went to Mexico to another family member. They infected the entire family in Mexico. They came back. The lady was the 4th Irvine patient who got hospitalized, and the son and the father and the daughter, they were not hospitalized, but the lady was the mom was the 4th patient COVID patient in Irvine. So we go to the UV system. There are three types of UV we are looking at: UVC, and for different. Now the irony in UVC is that essentially it neutralizes them. It doesn't actually kill them, although there are some papers that says it will kill them. It actually neutralizes them so that they cannot reproduce. Okay, so now in these viruses, again, by the way, we know the influenza is out there. If you do add the UVC, the other beauty is that a UV system is actually an incandescent lamp, but now there is a LED UV system, which I've not purchased, and the longevity of it's far more. A UV system has only 1,500 hours of good energy, and you have to toss it away. That's less than a year, and that's one of the costs. And it's not. It's about every lamp is about $50 or so, but now there is an LED one, et cetera, et cetera. Now it is relatively appropriate, affordable, effective, and the other beauty is that also within an air conditioning system, it also gets rid of the mildew within the body because of the light propagates through the air conditioning. It actually gets rid of the mildew throughout a good distance on both sides of where the placement of this air conditioning is. By the way, UV is not new. UV has been there, and most of the high rises we have been putting in regardless long before COVID. And the bacterias are definitely gone, and 90% reduction. Again, UVGI has a 90% reduction, and I understand it's more like 9,000 hours as opposed to 15,000, but don't quote me on this. I put this down, but it's less than a year. The old UV, I do not know the new ones, but in order to look at the UV doses, you're looking at for SARS, etc. You're looking at 600 microjoules. Again, by the way, joules is in watts per second, 600 per centimeter square. So if your air conditioning is X amount, your value of square feet, you multiply it by the appropriate number, you get the centimeter square. From that point, you get the wattage you need. There is another factor which I've never been able to pick up from even the scientists on this. There's a contact time. What is the contact time of this UV and the airflow? That has never been mentioned. In my pond, I have a 2 feet system, and it's going at about 68 divided by 20 feet per second, the water, and it's about 20 feet per second in 2 feet. So it's about 0.1 second. The water sees this UV for the energy that it sees. That has not been quite there. The second item, which is called air ionization, and in fact, by the way, this guy was not a Crook. His name was Crook, but in 1879 he identified the plasma or radiant matter. Somebody else coined it. J.J. Thomson coined it, and Irving Langemeyer in 1928 with Crook tube. That's what it's called. He created some sort of a ion system. Believe it or not, this is very, very simple. I asked Gil, is there any format, because I was trying to find a couple of companies to give, some little cookies or something. I was going to put a quiz, and if anybody wins the quiz, they will win, and I could have that company send you a little gift. I was not going to do it. But one of the questions that I have is this. If dust is heavy and gravity brings the dust down, why would your ceiling get dirty? So if you know the answer, please throw it on the chat. I'd like to find out if you can go that far. You can think about it. But if I'm going to give you this, it's called van der Waals forces. Van der Waals forces is that all dust, especially when you look at the sun, passing through your window, you see all these little particulates, right? All those particulates, they actually have charge. And if they get close to another body, i.e. the ceiling that is charged, what happens is they get attached, and that's why your ceiling gets dirty. But anyway, that was the answer for that. But anyway, you have Mr. Cook coming out with this. And I can tell you when the UV light is added is in that system and it shines in terms of the wet side. On the dry side, what they do is as follows. This right here is a bipolar ionization. It's very, very simple, by the way. It's very, very low voltage in terms of so what you have is you have a device like this. You have a pole here, you have a pole here. This is negative, this is minus. And you literally add it to a battery for the sake of argument. What happens is that it creates a magnetic field right here. So when the airflow is actually passing through, all these ions and the bacteria, et cetera, what happens to them? They all get ionized. And guess what? When they get ionized, their positive and negatives get collected together. Remember, we said MERV 13 will not pick up the viruses. Now they will, because these ionic bipolar needles are not very expensive. I'm going to be actually buying a couple of them and start doing my own little experiments. So anyway, that's what that is, the bipolar. The only issue is that they have to be listed by an organization, UL 2998. One of the reasons is that these ions, too much of it is bad for global warming. And guess what? If I am promoting it and everybody goes out and buys it, if you're going to affect the ozone layers, et cetera, that would be the issue. So really, that's the component. They all have been tested, and you buy. Now the irony is, I was at at Costco. There are all these mumbo jumbos. I don't know if anybody knows where the word hocus pocus comes from. Hocus pocus in Latin is hoc est corpus. This is the body. The Christians were saying this is the body in the church. The Latins were saying hoc est corpus, hoc est corpus. They thought it's magic. So hoc est corpus became hocus pocus. So essentially, there are a bunch of hocus pocus out there in Costco, and they're saying, I'm doing this. I'm not quite sure where they're going, especially when they're saying they're going to be picking up at the HEPA rating. So the fans are so small, there is no way in the world they can go 1 inch static pressure. So that's where the hocus pocus comes from. So in-room portable air cleaners are out there. And again, there's a delivery rate and there's a air change per hour. Let me give you one item on the air change per hour. In fact, Bill and I have a discussion because they're looking at a building and they were looking at this air change per hour. One of the issue is that if you are renting a space from anyone, any one of these big realtors, you're renting them. The issue is that you are putting the lease down, and they're simply saying, "I'm going to give you the air conditioning that I have, not what you want." So as Bill was asking for more air changes, they simply said, "No, I'm not going to give it to you." So essentially, that's an item. What is an air change per hour? Is that if you take the volume, in fact, let's draw that out. If you simply take the volume of the space, wrong color. If you take the volume of the space and you multiply it by the number of air changes that you want, inches per hour, and you divide it by 60, that's the number of CFMs that you're going to get for your air change. So again, for bathrooms, you're looking at 10. For a normal air conditioning system is 10, A6. By the way, this 6 is actually, so if this is the room, this 6, you got the outside air coming in and you have the air rotating here. That rotation that comes back and picks up the outside air, that's 6 air changes, including the outside air. In the bathrooms, which is about 10, and we always design it at 12, 15, or 20, that's when it's 100% outside air, or you bring in whatever source that you have and you take it through exhaust fan. So in restrooms it works, but if you want more air changes on the OSA, you're not going to get it. And the only time you're going to get it if it's in the is in the economizer mode. What we are proposing next time when we discuss, we like to see at least 50% outside air till this COVID issue, these vaccines issue, et cetera, is all solved and gone. So really you want to have that done, because again, we do not want Jacoby and Myers to call us. And let me see. What am I doing? Okay, we are going back to this. So, okay, now we got chemical disinfectants. Those are chemical issues. Those are items that you will be doing on a daily basis. Again, you're going to have some sort of within your company, you're going to have some sort of a risk management person who's going to go do everything, whether there's a nurse or if it's a very, very large firm, it's going to be an individual who's licensed, et cetera, to go back and does all of these issues for chemical disinfectants, air conditioning systems. And you want to have, again, I was involved, I actually was talking to one of the consultants who was working against a hotel for the Legionnaire disease in Las Vegas. All I can tell you the horror stories and how much money they paid out in the Legionnaire. By the way, people died, both in back east and in Las Vegas. Vaporized hydrogen peroxide, those are just chemicals that you're looking at. Pulse xenon, there's another type of UV system. Those are not that popular, especially xenon. They're talking about even a visible light in a 405 nanometer. That's your for ultraviolets. That's 205 or 230. Those are the nanometers of the system. Those are different discussions. Of course, the most energy, it would be UVC, but it does damage skin and eye. You want to make sure that you're protected in those fashions. And at the same time, you're looking at the COVID-19 spread in terms of there's a little summary that I put in, that's the HVAC system, in-room devices, mechanical air filters, electronics, UVC, and maybe there is other emerging technologies. I'm not too very much of a ozone guy, but I'll leave it at that. So the other issue that I have is that I really wanted to sort of, I will go to the next section. I'm speaking at 90 miles an hour. I am at the end of my part one, but I will go on to the other ones. But I may want to entertain questions right now. But let me just give you this. At the end of the day, if you are going to go to a lawsuit, a BMP will be required. All of your systems, all of your design guidelines, et cetera, et cetera. If you're part of that building, I can guarantee you, you will be part of et ali in Latin means and others. It could be your cousins, et cetera, that was just having a lunch in your architectural firm. Who knows where these attorneys, by the way, the only reason in Chicago the attorneys have their hands in their pocket is because it is cold. In every other state, their hands is in somebody else's pocket. But going back to this is that we discussed compartmentalization, which is NFPA 101. Filtration that we talked about was the UV system. That again, I'm sorry, filtration, which was MERV 13 because it is the code. The other ones are too expensive. Ionization, again, we want to ionize them so that they will coagulate, they will become fat, and they can be captured. But don't forget, if you let the air conditioning company design that thing, they will not put it at 300 feet per minute. And if it is not 300 feet per minute, when the particles are going through the filter, it will not be captured. Every one of these, and the air conditioning contractor will have a small little filter, as opposed to the design firm will have it at 300 feet per minute, depending on the CFM. So if it is a 6,000 CFM system divided by 300, your cross-sectional area, your filtration must be 20 square feet, and that would be large. That's 20 by 50, 24 by 5 feet. So the other item is surface contamination. I highly suggest to all the architects that simply verify what your surfaces are. By the way, fabric surfaces are wonderful places for COVID-19 to be captured. If you look at a regular hospital bed, any loops and crannies where the air can be, let me show you, um, any any locations in the where you have this is a hospital bed, etc. When the air is passing through, you're going to have these elements, these coves. You want to have as many smooth surfaces because this area will be a collection of the COVID. And at the same time, you really want to have clean surfaces and or very smooth surfaces. System selection, again, it goes back to your design. I know throughout my history, 33-year history, I've always have been battling with the architects about space and type of selection of the units. That right now, maybe through pandemic, you guys may have to let us do a little more decision making. Quite number of other untold parameters are out there in the design or creation of the building. But at the same time, if you think like a hospital setting, you will be more apt to think in the right direction. Again, compartmentalization. I've done a lot of insurance companies where a lot of components were not able to different, for example, legal team, where the archives were, etc. They were not allowed to have any interaction. Might as well, you will be having the same thing. And absolutely no outside deliveries. Any outside deliveries will not be able to bring in. So your outside delivery individuals will be totally outside of the building, will not be allowed through the bubble, your family bubble or company bubble. Anyway, this was the part that I simply may have gone very fast. But just to let you know, I will go on for another 8 minutes and tell you what's happening next time. I am going to continue with this on the CDC guideline, and it shows some of the guidelines that is there. And then again, if you deal with cleaning and disinfection, maybe again, don't forget, when you were dealing with a green code, California green code, there were a bunch of notes that have to do with your selection of green products, your glues, et cetera, et cetera. This would be almost the same thing where any cleaning, disinfectants, et cetera. I don't know if it's going to get into your drawings, but that would be part of this. And I do know in LEED when you're putting all these chemicals, and I don't know if you've realized both Walmart, Lowe's, as well as Home Depot have a giant now, totally a different section for cleaning agents, et cetera. And if you are doing LEED, you will identify that these chemicals have to be in a certain location because the volume that you're holding, and they have to have their own exhaust system. So they just an FYI for your designing, just to, if you want to follow by the way, the hand dryers are all gone. God bless the drinking fountains, they're all gone. All of these systems that you had part of your design is no more, or as they say, no mas. So there are other policies that you will be trying to do. Technically speaking, I do know there are quite a number of there are companies that will not bring their help desk centers into the company. They may just simply leave them at home just to do this or this. And I do know with my 3 kids, they're all in graduate schools. None of them are going to class. And when I was a professor, that was a very, very odd thing, but then now it's called a normal thing. And again, the etiquettes that as you're doing restaurants, healthcare centers, etc., you have all that part of the system. I don't know again how far you would be getting into the CDC guidelines. I put down all of these references on CDC for next time you guys will see it. And at the same time, I put down the BOMA because most of the high rises that I have, they use BOMA as the primary reference, especially on their guidelines, etc. I put this whole thing and I transferred it into Word there. I am going to, again, uh, these are there, somebody has their, their system not mute. But anyway, communication with tenants, etc. These are all part of the BOMA. I put it in there just in case you are dealing with property managers as well. Then what I did was, again, COVID information. I went through quite a number of the, this is the AIA, main AIA website, which is really doing nothing except talking about your how to run your company. Let me go to open up to questions or any discussions, only because I'd rather, oh, this is the National Law Review. I'm going to bring up the court cases, which is out there, and there, this discussion has begun. Again, either somebody dies in the building and the codes are initiated. And I always say, when I was getting my civil license, they always said the number of, whether a street block is going to get a traffic light is the question is how many people died or how many people had an accident in that traffic light. Otherwise, the city will not spend and put a traffic light there. But I am just thinking, if there is any, I'm going to go back to the chat room, or if you want to and you want to entertain any questions, because again, this is a very much of a open door, and the discussion is very, very, very wide. Again, if the Republicans are going to be pressing, and they do get the that part of the built that part of the funding that they're giving, and they simply take the liability of the lawsuits away, then the issue becomes is that this will be enacted a little slower. Maybe the code bodies are doing. I am working with IAPMO on the plumbing side, and I'm also working with ZERN on the manufacturer side. The irony is that the lighting industry, I don't know if the lighting industry is going to go get into a UV system, although that is very interesting. But I do know in certain hospitals, especially in one of the articles that you will see next time, that they are simply saying introduce UV on top of the like wall sconces facing up, so that, because that is the what's called the upper chamber. We have two chambers. One is called a people zone, which is 6 feet would be for us to breathe. And then you have another one, which is up there. And I saw that in the hospital that I was working on, the Nurses Association forced that hospital to put these UV lights into, I know, and Adrienne is on the system. Maybe she can chime in if there is any UVs out there in there.
Yes.
You
Thank
do
you
have
for mentioning it. I'll send you some of the details. The product won't be launched until January, although the spec sheets and all that and products in testing. But it is for upper air, so an indirect pendant that only has UV, or it can be white light down, UV up. So it should be more tolerable for the occupants.
Was that initiated because of the pandemic, or they had that into production a long time ago? Was that because of?
Yeah, it was the pandemic.
Very interesting. But I will show everybody the next time the section that CDC does say upper chambers and discusses it. And ASHRAE does bring up that issue as well. So it's very, very, very interesting. But has anyone?
Sorry, I was just going to say it was very effective against tuberculosis in clinics for the upper air chamber. Yes.
Yeah, no, it's just that the issue is, again, I just wrote a paper for IAPMO where is probability analysis, where I will just show it in here, that if you have your probability of success, or is 1 minus probability of failure. So let's say probability of success is you have like the ionization is only 99%. the UV is 96%, and it goes on. The probability of success is actually 0.99 times 0.96 times whatever else you're doing. So that number actually goes down. So if you have 100 people there, you're simply saying 2 individuals are not protected, if it ends up to be 98 for the sake of argument. So the issue is that in a court of law, that's how they are looking at. But again, if we are doing it and there was a code that was established, because as when I was doing my fire protection program, the guy said that no one has designed a mall for someone to take cocktail Molotov and throw it in each one of the stores. Malls were not done that way. But at the end of the day, you know, if there are individuals, etc., you have to make sure that 2 individuals will not get infected. But anyway, that was the one discussion. But to go back, thank you for that. But I don't know if anybody is going to add to or chime onto this if they want to unmute themselves. But I don't know if any one of you have been approached. I know Bill and I are working actually together on a building together out in somewhere up in northern LA, and working on this issue. And again, Bill has a vast knowledge on the medical side and risk management side. But if anybody wants to chime in with any questions or any of your thoughts, again, this is a very, very, very new frontier. And I am very sure that we want to make sure that as an AIA individual, you are secured and Jacobian Myers will not call you.
I can interject. I've been, I do veterinary architecture, and I've been doing, using high energy UVC type C emitters in the supply plenums going on for the last 10 or 15 years now, using an active exchange rate of 10 and zoning. So if anybody has any questions, I wrote a little blurb on one system you might want to look into. It's called Sterile Air, STERIL-AIRE. That's one such, and then there's other ones on the market, but we religiously put them in all our package units in the supply and return plenums rather, so with a 50% makeup. Pretty effective.
Wow, 50% makeup. Wow, very good, very good.
Yeah.
All I can tell you is that all of our AC units, 25 ton or more, they all have that system. We do not buy without a UV. Now that the needle points are out there, they're very, very cheap, and you can add them to the system, and it'll make the effectiveness of the. You are MERV 13 anyway, so if you add the system, now that the fact that you've done zoning, technically you've done all the above, but you are doing it for the vet system. It's correct?
Correct. The other system we use is we're using multi-zone compressors or condenser units with cassettes, similar to what is used in hotels, but each multi-zone unit will control up to about 30 cassettes. So you can put each cassette, and it has its own 2-inch fresh air line that goes into each unit. It weighs about 35 pounds. It sits flush to the ceiling. You can put it in a T-bar ceiling system. It looks like a conventional register. The only difference is it's controlled thermostatically through each room, and then also it's tied back to a main computer for control of the free.
Those are called VRF. An example that I actually showed was exactly that. Again, I used to use Mitsubishi. I do not use Daikin. Now I am a Samsung guy. And again, they are very good and very, very effective. And again, there is a problem with these units. And I will put that into, there is one problem with it. In fact, I got hired by a city to go in and fix that issue. And they are not very good controlling the humidity levels. So we have added a dehumidifier into the building.
Yes. Yes.
Just an FYI, if you're going to go that way, you have to have a dehumidifier. And again, Samsung has this 44-ton that goes to 64 zone, literally every room.
Wow.
It's going to have it, and they are going to control it, so nobody's going to infect somebody else.
Yeah, we have them installed in about a half a dozen hospitals here in South Orange County. If anybody wants to contact us, would surely give you a little insight
Perfect.
to it in terms of how it's.
Yeah, if you could send that blurb into to me, let me put it into my system with my
I
name.
I put it into the Zoom chat.
Perfect.
I listed it there.
Perfect.
Hopefully my name came up. So
And I'm sure it would. But
Good.
anybody else wants to chime in before we call it in 5 minutes? Bill, do you have anything to add? I don't know if Bill Calvert wants to chime in, but overall, again, I am just thinking loud that we got to do something. The fact or the silence of AIA, the silence of ASHRAE, the silence of everybody. And again, the only issue that we are looking at, the manufacturers, because they have found this opportunity, i.e. Kelly just mentioned, Adrian just mentioned it, they found the opportunity, so now we have it. Now it would be great to use it. Again, that would be a prudent avoidance. Remember, we talked about it. Now you should add to it because it'll give you another flavor or something, but at the same time, it'll help to the system. I don't see anybody else raising their hand, but the most critical part is I am going to ask you all to be extremely safe. I will have the number of cases that I'm going to be showing on here is quite high. And the more I speak to it, the more I was getting scared. And this was a building ventilation system. This was a one choir practice, 2 death, 53 cases, 53, I think I mentioned it. This was the choir practice, the timing that they met, the practices. And then I have another one, which was extended family gathering in February in Chicago. And I have more, which I have not dumped into here yet. This is the form of the contact that was, again, we are looking at how to ensure within a building, we would be able to stop that. Now, the irony is, okay, I'm not going to go against, because I am still baffled that the First Amendment has overridden the health issues, where the churches and churches as well as protest. There's a First Amendment, you can have it. So the most critical part is maybe we should attack that as architects and engineers. We should attack that first, just an FYI. And it goes on, and I have quite a number of other cases for you. And I will see you in Thursday, and please be there and we will discuss more. And I will be posting your Rich. I will be putting Rich's work into so that we will enjoy his work out of he's been already doing it, so that's great. The only thing you haven't done, I guess, it would be the needle point, the ionization, correct, Rich? You need to unmute.
Yeah, there. No, I have not done that. That's something I need to take notes on and learn more.
That is very cheap. You can always add on. And Adrian, I would love to see any write-ups on that so we can show that off for the audience next time.
Hey, so I'm Bill.
Hi, Bill. Go ahead.
Okay. No, the only thing I wanted to add is just, be cautious anytime you're trying to engineer out a hazard, to make sure that the hazards that you're kind of creating with that or changing that hazard environment, that you're taking into account some of the controls, maybe farther down in the hierarchy as far as administrative controls, PPE, lockouts, whatever, that also have to be there. With high energy UV, you have part of that band that is considered and confirmed injurious to humans. And then you also have part with the evidence suggests is not injurious, like around the 220 nanometers that are coming out both in LEDs as well as in emitting tubes. But the emitting tubes will only isolate those frequencies to a certain extent. And if there's anything wrong with those, or at their end of life, say get scratched or damaged or cracked, they can give off other wavelengths that aren't protected. So you got to kind of consider that when you're engineering in your their solution, the occupational exposure issues. The American Conference of Government Industrial Hygienists actually has a really good handbook for folks that are designing that you can take a look at, the TLV BEI book, and I put it in your notes as a reference. So
Okay.
that might help folks that are considering that.
Very good. By the way, every time I chat with Bill, I gain just horrendously. Just an FYI, just to let you know. I have enjoyed working with him.
So,
Yes, sir. Go
Jeff,
ahead.
you may want to check the chat line. You do have a few questions in there you might want to answer.
Okay, let's go to it.
There's one about the heating cycle from Byron Jeanette.
No, if it's Brian, no, I'm not going to answer it. No, I will answer it. Brian is a good friend, so I need to. Let me find out. Let me find out where my chats are. Sorry, guys, I'm feeling dumb. Yeah, I am having a hard time finding. Go ahead, read the question. I'm going to, oh, right there, found it. It was on the side. Yeah. Let's go to, let's go to.
Good question.
This is Brian.
Yes, sir.
My question, are you hearing me okay?
I am good, and I found your question.
Okay, yeah, the question was about whether the heating or cooling cycle is going to be, will exacerbate the transmittance of the virus more so than a cooling cycle.
No. The temperature gradient of this thing, it has one of the interesting thing about they say that influenza only comes in winter. No, influenza is always there. You just have you go inside a cubbyhole of a house and we just get it more. Temperature does not affect this. And the only issue that you have on the air conditioning, your air conditioning size, because you are bringing so much outside air, and you have to cool that air or heat that air, your air conditioning size, if we follow the guidelines that Rich was talking about, 50% outside air, the air conditioning size really goes up. Let me give you another example. Let's say you are doing it in Las Vegas, and the outside temperature of Las Vegas is 195, 100, etc. Your air conditioning size, your 3.5 ton in Orange County, is actually a 5 ton equivalent in Las Vegas, in the desert, which only gives you a 3.5 ton. So really, my issue is that your tonnage goes up. The answer is no. It's not that cold or hot, and will not affect the virus.
Great, thank you.
Yeah. I do know that there is the UV. There is a Bill put down some information about the contact time. I'm going to pass it on. We can't see your sketch. I want to apologize for that. I didn't know why. The Bill Calvert also put down a reference in terms of the threshold limit value, and I will put that up for you all. I see the Brian's question. Bahram is asking, can we obtain this document? The answer is yes. I do know my WordPress is actually working. I will put the whole thing back into my blog. It's Psalm's blog, is actually at greenerate.com, and you can have it. Richard Drew is Raul.
Wow, that's correct. Yes, that's fine.
Anyway, he's going to send me the information. Yeah, Stereo Air is actually by US Air Conditioning, and I met the guy who actually started the company. That was 10, 20 years ago.
Mm-hmm. They've been around for a while.
Yeah, they've been a while. Yes.
Mm-hmm. We basically started using it for odor control in the facilities because it's odor is a byproduct of bacteria, and you kill the bacteria, you eliminate the odor. So that's why we used it.
The only issue that is very interesting, I've done cases on odor. Odor is very interesting subject. Mm-hmm. And I can tell you the unit of odor is OLF, O-L-F.
Yes.
And the bacteria, you can actually get rid of it, therefore the odor goes. But if you can't kill it, and it's paint, for example, you can't kill it. Mm-hmm. But that's very interesting from Rich. They do actually 10 air changes with 50%. Brian, that's a lot of air conditioning for a home. Legal suit, Mark Enns against architect Jacobian Myers types, etc. I say, all I can tell you is that there is more attorneys in this country than the entire Europe combined. And they have nothing else to do. And my wife does about 45 cases a year.
That's
So
scary.
just watch out. So anyway, there was that. And then Charles Young has second question. What about, do you think of water futures as an COVID element prevention? The only thing that I can tell you is this. I'm doing a very, 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 very expensive home and then they literally asked me, can you put scrubbers? Scrubbers is a water element that we use for so much for particulate from restaurants, etc., and is about $100,000. And this individual at this particular house with like 44 zones, he's looking at me to put scrubbers. I am definitely going to be putting UV, and I have not discussed it, but I don't know who the owner is. It's a mystery owner, but that's a very interesting item. I do agree with Thaddeus. I truly believe when you were doing the Y2K, when you were writing a seminar, please write a seminar, or please add, maybe some of you can come down and put down something that simply says, how do you write a CYA note in your contract that you will not be dinged on by somebody? Again, that was all the questions. I appreciate it. 6:07. Thank you for hanging out another extra 7 minutes. I will put this on my my blog, and then I will have a part 2. Or if you wait, I will put the whole thing in my blog on Thursday, because I still have to add more stuff to this. And when I'm talking at 90 miles an hour, because I cannot get handcuffed, I don't get arrested. So I was talking too fast.
What is your email address?
SNOUR58@gmail.com.
58@gmail.com. Okay.
Yeah, that's the more secure one.
SNOUR58@gmail.com. Okay, thank you. Right.
Thank you very much, everybody. And I'm trying to, my job is maybe is to scare you, but at the same time, is to make sure that you are safe and your clients are safe. And again, I don't know where this is going, but it's very scary, especially what CDC says. And if they come to you and you design something, and then the owner says, excuse me, I'm just a dumb owner, invent. You are the professional, so you just want to protect yourself. Very good. Otherwise, God bless you all.
Thank you.
Do whatever Jeff said about your phone numbers, etc., that you can get your CU credits. Anyway, given that note, I will do the stop sharing, and God bless you all, and just stay safe. That's the most critical. We need you next time.
Thank you.
God bless you all.